Hey everybody, what's up? Physical therapist Dr. Whelton. So I just finished up this really emotional evaluation. This poor lady, she came from a town I've never heard of. It was like an hour away. Her fiance made her come. She comes in and she's like, I almost canceled my appointment just because, like, what's the point? She goes, but here it is. I got this freaking pain in my back, down my legs. She's like, it changes. She's like, I've had it for 10 years. She's like, nobody knows what's wrong. I've been to everybody. All I hear is, oh, you need a deep tissue massage, or oh, you need injections, or oh, you need another adjustment, or something like that, right? Anyways, she's like, you know, she's just, you could tell she's just had it, you know, and she doesn't even want to be sitting in front of me, right? So anyways, so I start my evaluation with her. I'm like, what bothers you? Like, what do you do that it bothers? She goes, I can't walk. She goes, I'll walk up and down your clinic. And she goes, I get this like shearing pain in my hips. She's like, and then it goes down my legs and then it's in my back. She goes, I can't, I had to quit my job. I can't do anything, right? And she goes, and nobody knows what's wrong with me, right? So I'm like, I know what this is. This is SI joint dysfunction, sacral torsion, sacral shear, right? So anyways, I'm like, so I realign her, right? I realign her, I pull on her legs, gap open the SIs, lay her on her side, I gap open the SIs, and then rotate her sacrum back. My left thumb dropped, I rotated it back, right? And she's walking up and down my clinic, no pain, right? And this lady literally just starts sobbing. And she's like a funeral level sobbing, like uncontrollably. And I'm like, so I'm trying to talk to her, but she can't talk because she's sobbing. And it goes on for like 5 minutes, and I'm like, and she's like, I am so sorry. I'm like, don't feel bad. I'm like, I'm like 90% of my page, I said three people we cry when I give them this diagnosis, unfortunately for them, Anyways, it's unbelievable what these people go through with this mechanical back pain, and they have no hope except for us, the people that know how to fix it, So anyways, nobody should have to go through what these people have gone through. And, when I told her I could, she's like, cuts me off. And she's like, so you can fix this? And I'm like, yeah. And she's like, no, really, you can fix this. And I'm like, the fact that people have to ask the question that way is unbelievable. But yeah, I can fix it. We can fix it. We need to save these people. If you work in a clinic and people are not screening every back pain, hip pain, thigh pain, groin pain, leg pain, knee pain patient for SI joint dysfunction and sacral torsion and shear, then you walk up front and you tell the secretary, I want to be a back specialist, and you take all the back pain patients off their schedule, because when they leave those clinics, they end up, like this lady, and she told me she's been suicidal before. It's unbelievable. It's unfreaking believable what these poor people go through, and they don't have to go through it because it's beyond easy to fix. So if you work in a clinic and people are not taking it seriously and they're not screening these patients and they're not putting every patient from L1 to the foot on that SI joint protocol as a prophylactic, then you walk up front and you do it to save these people, because this is a pandemic. I cannot even believe the level of suffering this creates. And I had been a therapist 10 years and I had no idea that these people even existed. It's unbelievable what these poor people have to go through. And the fact that this lady is sobbing, like funeral level sobbing, because she found somebody that understands SI joint and sacral torsion and shear, is a travesty, if you ask me. But we will save these people. Please put everyone L1 to the foot on that protocol. Peace.